Hot and cold combination therapy, the easy way to recover faster. Have you ever hurt a muscle and wondered, should I use ice or heat? Here's something most people don't know. Using both together in turns can help you recover faster. It's called hot and cold combination therapy, or simply contrast therapy. Today, we'll break it down: what it is, how it works, when to use it, and how to do it safely at home. 1. What it is. Hot and cold combination therapy means alternating between warm and cold temperatures to support recovery. You might use a warm towel, then a cold pack, or move between a warm bath and a cold one. Why does it work? Because it helps your blood vessels act like pumps. Heat opens them up. Cold makes them tighten. That gentle opening and tightening motion pushes out waste and inflammation, while bringing in fresh oxygen and nutrients. It's like a mini workout for your circulation. That's why athletes often use this when soreness doesn't go away with just ice. 2. What science says. Research shows that contrast therapy may help reduce muscle soreness, stiffness, and fatigue after intense exercise. It's not a miracle cure, but it helps your body's own healing system work more efficiently. Think of it as giving your recovery process a small boost, naturally. 3. How to do it safely at home. Let's go step by step through 3 simple ways to try hot and cold combination therapy safely. Method 1. Hot and cold bath, for feet, ankles, or hands. Prepare 2 containers, 1 warm, 1 cold. Warm water, 100 degrees Fahrenheit to 104 degrees Fahrenheit, 38 Celsius to 46 degrees Celsius. Cold water, 46 degrees Fahrenheit to 59 degrees Fahrenheit, 8 degrees Celsius to 15 degrees Celsius. Soak in warm for 3 minutes, switch to cold for 1 minute. Repeat 3 times ending in cold, total about 15 minutes. Method 2. Hot and cold compress, for back, shoulder, or knee. Use a warm compress or heating pad for 3 minutes. Then switch to a cold pack wrapped in a towel for 1 minute. Repeat 3 to 4 rounds. Never apply ice directly on your skin. Method 3. Contrast shower, quick and easy. Take a warm shower for 3 minutes. Switch to cold water for 1 minute. Repeat 3 times, ending on cold. Perfect after workouts or long, tiring days. 4. Real-life examples. Example 1. You wake up after a tough workout and your back feels stiff. Use a heat pad for 3 minutes, then an ice pack for 1 minute. You'll feel the tension melt away after a few rounds. Example 2. You twisted your ankle a few days ago. The swelling is mostly gone, but it's still stiff. A short, hot and cold foot bath can help clear up that leftover swelling and improve mobility. 5. When not to use it. Avoid hot and cold combination therapy if you have heart problems or high blood pressure, poor circulation or varicose veins, diabetes with nerve damage, open wounds, bleeding, or skin infections. Also, skip it during the first 48 hours after a new injury, since heat can make swelling worse. And stop immediately if you feel dizzy, numb, or uncomfortable during therapy. 6. Safety tips. Always check water temperature with a thermometer. Place a towel between ice and skin. Never fall asleep while using a heating pad. If you're pregnant or have a chronic condition, ask your doctor first. Fast muscle relief at home. Now you know how to use hot and cold combination therapy to recover faster and feel better. Have you ever tried this method after a workout or an injury? Share your experience in the comments. I'd love to hear how it worked for you. And don't forget to like, subscribe, and turn on notifications for easier, science-based recovery tips. Let's keep learning how to heal smarter together.